All right, today we're going to be doing a full head to toe physical assessment. My name's Mackenzie. My patient's name is Marissa. Hi, my name's Mackenzie. I'm going to be doing a full head to toe assessment on you. It's going to take about 50 minutes. Do you need to use the restroom before we start?
No.
Okay. First, I'm just going to be assessing your general appearance. The patient is well dressed for the situation, well groomed. Her body is erect, it's symmetrical, she's calm and cooperative. Can you tell me your name?
Marissa Hicks.
And where are we?
The living room.
And what is the date?
December 5th, 2023.
And what would you do if you seen a house on fire?
Call 911.
Patient is oriented, her judgment is intact, and her speech was clear and articulate. All right, so first I'm just going to be assessing your head. I'm just going to be looking first. The patient's head is symmetrical, it's midline with the body. I'm just going to be feeling around, okay? Patient's head is round, it's symmetrical, no lesions or masses, and no sutures are felt. Now I'm going to be moving on to the scalp. The scalp has no flaking, no infestations. The hair is fine and evenly distributed. All right. Next, we're going to be moving on to the eyes. So I'm just going to go ahead and have you close your eyes for me. The eyelids close completely over the eye. Lashes are evenly distributed. All right, and open them for me. The sclera is white. It's clear. Just going to pull down right here, okay? The conjunctiva is pink on both sides. All right, now I'm just going to get my pen light and I'm just going to shine a little light in your eye, okay? All right, I'm just going to shine this light in your eye. The pupils react to light. They're about 4 millimeters in diameter. I'm just going to have you look at my finger and look at the wall. And look at my finger and look at the wall. All right. Pupils are round, they're reactive, they're equal, and they react to light. So therefore, pupils are perla. Next, we're going to be doing a vision test, okay? I'm just going to have you cover one eye and read the smallest line for me. We're going to do it on both sides, and then you're going to read with both eyes open, okay? So cover your left eye and read the smallest line possible.
LEFODPCT.
Patient has 20/20 vision in the right eye, so cover your right eye for me and read the smallest line possible.
LEFODPCT.
Okay. And patient had 20/20 vision in the left eye. Now read with both eyes for me.
LEFODPCT.
Patient had 20/20 vision with both eyes. Next, we're going to be moving on to the ears. So I'm just going to be feeling your ears, okay? I'm going to be feeling the pinna, the tragus, and the mastoid. The earlobe is soft, the article is firm. I forgot to mention that with both eyes we would have done the ophthalmoscope. This is when I would have looked for the red reflex in both eyes. Would have shined a little light in your eye. Next, we're going to be moving on to the whisper test. I'm going to have you cover one ear and I'm going to whisper 3 words into your ear, okay?
Cat, dog, mouse.
Okay, we're going to do the other ear.
Mouse, wizard, rabbit.
All right, patient passed the whisper test. Next, we're going to be moving on to the sinuses. I'm just going to be feeling above your cheekbones. This is your maxillary sinus. And your frontal, which is above the eyebrows. Any pain or tenderness when I do that?
No.
Okay, next we're going to be looking at the nose. The nose is symmetrical. It's midline. No deviations noted. I'm just going to have you tilt your head back for me. The nares are pink. They're intact, and there's hair evenly distributed. All right, next I'm going to have you cover one nostril with your finger and smell for me. So close your eyes. And what do you smell?
Garlic, salt.
Okay, and do the same with the other.
Cinnamon.
All right. Patient's nose is patent. Next, we're going to be moving on to the mouth. Just close your mouth for me. The lips are even. They're they're symmetrical. There's no dryness, no cracking. Can you smile for me? Teeth are evenly distributed. They're white, no missing teeth. All right. Can you stick your tongue out for me? All right. The mucosa is pink. It's glistening. The tongue has a grayish pink color to it. The border is rough. The hard and soft palate are intact, and the posterior pharynx is glistening and pink. Can you say "ah" for me? All right. The uvula moved forward when the patient said "ah." Next, we're going to be moving on to the neck. I'm just going to be feeling your carotid pulses. They're about a 2+ amplitude, smooth, regular rhythm. Now I'm going to be listening for bruits. I'm just going to be listening with my stethoscope, okay? On each side of your neck. Right, no bruits noted. Next, I'm going to be feeling for your trachea. The trachea is midline. Next, I'm going to have you swallow some water for me, and I'm going to be feeling for your thyroid. All right, thyroid was palpable when patient swallowed. So next, I'm going to be moving on to the upper extremities. So I'm just going to be looking at your arms. The skin is pink. There's no bruising or lesions noted. The nails are about 160-degree angle. No clubbing. Capillary refill is less than 2 in each finger. I'm going to be feeling your brachial pulses. They're about a 2+ amplitude, smooth, regular rhythm, bilateral. Now we're going to be doing the radial. They're about a 2+ amplitude, smooth, regular rhythm, bilateral. All right, so next I'm going to be feeling for your lymph nodes in your arms. We're going to start with the lateral, the central, the pectoral, the subscapulary. All right, and we're going to be moving on to the other arm. The lateral, the central, the pectoral, and the subscapulary. All right, now I'm going to have you hunch your shoulders for me. I'm going to be feeling the interclavicular lymph nodes. Okay. I felt them bilaterally. Was there any pain or tenderness when we did that? Okay. Next, I'm just going to be looking at your back. All right. Is it okay to move your hair to one side?
Yeah.
Okay. All right. And is it okay to lift your shirt up on the bottom?
Yes.
Skin is pink. Temp is consistent all over. No bruising or lesions noted. The spine, I'm going to be feeling down your spine. The spinal processes are intact. The posterior muscles are intact as well. And the AP diameter is about a 1 to 2. Next, I'm going to be percussing in each area. You're just going to feel me do this, okay? The lung sounds were tympanic in all areas. Next, I'm just going to be listening to your lung sounds, so take some deep breaths for me. Okay, is it okay to lift your shirt up and listen?
Yes.
Okay. Deep breath for me. And again. And again. And one more time. All right. All lung sounds were clear, bilateral. Now I'm just going to be checking for CVA tenderness, so you're going to feel this, okay? Any pain or tenderness when I did that?
No.
Okay. Now I'm going to have you lay down, and I'm going to cover you up. Go ahead and lay back for me. All right. I'm just going to be assessing your anterior chest. The patient is breathing regular, no retractions or bulging, and she's breathing with ease. The chest is pink. The temperature is consistent. Now I'm just going to be listening to your lung sounds. Okay. Take deep breaths for me. Is it okay to go down your shirt? Hurry up some more. Alright, lung sounds were clear. Now we're going to be moving on to your heart. So I'm just going to be feeling around your heart first. I'm going to cover you up. Is it okay to stick my hand down your shirt? Okay. Alright, I'm just going to be feeling around your heart. I'm going to be feeling at the 5th intercostal space at the mid-clavicular line. This is your point of maximum impulse. I'm just going to be feeling your pulse. Pulse is about a 2+ amplitude, smooth, regular rhythm. No leaves, heaves, or thrills noted. So now I'm going to move on and listen to your heart sounds, okay? I'm going to tell you each one I'm listening to as we go on. Alright, first is the aortic. This is at the 2nd right intercostal space at the substernal border. We're going to move on to the pulmonic. This is at the 2nd left intercostal space at the substernal border. And we're going to move on. Is it okay to move my stethoscope down your shirt?
Yes.
We're going to move on to the 3rd. This is herb. It's at the 3rd left intercostal space at the substernal border. And we're going to move on to 4. This is the tricuspid. This is at the 4th intercostal space at the substernal border. And now we're going to move on to the 5th. This is at the 5th intercostal left. The 5th left intercostal space at the midclavicular line. This is also known as your point of maximum impulse. Now I'm just going to listen for 1 full minute. Pulse is about a 77. Smooth, regular rate, no extra heart sounds were heard. Okay. Now we're going to be moving on to the abdomen. I'm going to go ahead and have you bend your knees for me. Is it okay to pull this blanket down?
Yes.
Okay. And is it okay to pull up your shirt?
Yes.
Alright, I'm just going to be looking first. The skin is pink, the contour is smooth, no noticeable peristalsis. The umbilicus is midline. Now I'm going to be moving on to listening to your vowel sounds, okay? We're going to start in the right lower, and the right upper, the left upper, and the right lower. Vowel sounds were normal in all 4 quadrants. Now I'm going to be listening to the aortic artery. It's about a 2+ amplitude, smooth, regular rhythm. And the femoral. It's about a 2+ amplitude, smooth, regular rhythm. And now the renal. It's about a 2+ amplitude, smooth, regular rhythm. Right, now I'm just going to percuss in all 4 quadrants, okay? You're just going to feel me do this, alright? Alright. All 4 quadrants were tympanic and resident. Now you're going to just feel me do light palpitation. This is light palpitation. The right lower, right upper, the left upper, and the left lower. Any pain or tenderness when I did that? Okay. And this is deep palpation. Right lower, right upper, left upper, left lower. Any pain or tenderness when I do that? Okay. Now I'm just going to be checking for rebound tenderness, okay? Any pain or tenderness when I do that? No. Okay. Now I'm going to be checking for your aortic, femoral, and renal pulses. I'm not able to find the aortic pulse, so I'm going to move on to the femoral. The femoral pulse is about a 2+ amplitude, smooth, regular rhythm. And move on to the renal. It's about a 2+ amplitude, smooth, regular rhythm. Now I'm going to be feeling for your liver border. So just take a deep breath for me. The liver border was not palpable. Now I'm going to be checking for hernias. So I'm just going to have you put your legs down for me and lift your head up. And no hernia was noted. I'm going to pull your shirt back down and pull up the blanket. And is it okay to pull up the blanket to assess your lower extremities? Okay. Now I'm just going to assess your lower extremities. The tip is consistent all over. No bruising or lesions noted. No edema noted. And no varicose veins. Next, I'm going to be looking at your capillary refill. The nails are about 160-degree angle. Capillary refill is less than 2. Now I'm just going to be feeling for your posterior tibial pulse. It's about a 2+ amplitude, smooth, regular rhythm. And the dorsal pedis pulse, it's about a 2+ amplitude, smooth, regular rhythm. Now I'm going to be assessing for pain over your joints. Any pain or tenderness when I do that? No. Next, I'm just going to check my paper and make sure we didn't miss anything. And if we did, we're just going to go back over it and hit it real quick, okay? Alright, I forgot to assess your lymph nodes in the upper neck area. So I'll just have you sit up for me and we'll go over that real quick and we'll be finished with this part of the assessment. Alright, so I'm just going to be touching around your face and your neck area, okay? Alright, so first is the periauricular, the posterior auricular, the occipital, the deep superficial, the tonsillar, the subdicular, superficial, clavicular, and then the submental. Any pain or tenderness when I do that? Okay. And we are finished with this part of the assessment.